Hello everyone, I am Dr. Sarada M, Consultant Obstetrician and Gynecologist, Lap and Robotic Surgeon at Yashoda Hospitals, Somajiguda. Today, let's talk about cervical cancer screening. So, what is cervix? Cervix is a lower part of the uterus. So, we understand that uterus is an organ where we get our periods and the baby forms. The lower part of the uterus is called as cervix. And cancer of that organ, cancer of cervix, is the most common cancer in women. And we can screen for this. That means we can catch this at a very early stage. Even in a pre-cancerous stages, we can catch hold of this disease. So how to know that we have cancer or any pre-cancerous stages of cervix? So each country has their own guidelines to screen women for this cervical cancer. So US has its own guidelines, UK has their own guidelines. Similarly, our India has our own guidelines formulated by the Government of India on our national program and also by our Gynecological Society, FOGSI. So what do they say? What do these guidelines say? So there are three different methods of screening for cancer. One is pap smear, the other one is HPV DNA test, and the other one is a visual inspection of acetic acid, VIA. We call this as VIA. So our government says based on your resource settings. So if you are at a center where you don't have the resource to do a pap smear or a HPV, at least do VIA. It's by simply applying the acetic acid to the cervix and take a picture of it and then assess if there is a risk or not. That is called as VIA. The HPV test and pap smear are done from below. So there's a small brush or a spatula and a doctor puts in a speculum in the vagina and takes out some amount of sample onto the brush from the cervix and it is tested. So what is the gold standard? Should we do a HPV test or a pap smear? So now they say instead of pap smear, HPV DNA test is a gold standard. And if HPV is positive, you are more at risk of getting a cervical cancer. And how frequently should we do? If we are doing a pap smear, so all this screening should start after 30 years of age. And if you're doing a pap smear, do it once every 3 years. A HPV DNA test once every 5 years. So if once you are HPV negative, you can relax for 5 years and get it done after 5 years. And similarly, VIA, visual inspection, also once every 5 years. So get screened for cervical cancer and know your risk if there are any early stages of cancer. Thank you.
Like, comment, and subscribe for more health updates.